Please. Thank you very much. The Honorable Minister of Information and National Orientation, the host minister and the chief moderator of this event, Alhaji Muhammad Idris, fellow, Nigerian Institute of Public Relations. The coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, CON. Permanent Secretary, Federal Ministry of Health and Social Welfare, Madam Kachalom Daju, MNI. I welcome you. The sitting Permanent Secretary, Federal Ministry of Information and National Orientation, Mrs. Comfort Ajiboye. You're welcome. I welcome all the directors of both ministries that are seated here today. I welcome all the Director Generals and Chief Executive Officers of parastatals and agencies under both ministries, editors, bureau chiefs, and members of the press. I welcome you, very distinguished ladies and gentlemen. I welcome you all to this ministerial press briefing. This is the third in the series. The maiden edition in the series featured the Honorable Minister of Agric and Food Security, Senator Abubakar Kyari, CON. The second in the series featured the Honorable Minister of Industry, Trade and Investment, Dr. Doris Anite. Today, by the grace of God, we are featuring the Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate. Very distinguished ladies and gentlemen, at Ministerial Press Briefing of this series, we share very useful information. We exchange very constructive ideas. And we want to believe that at the end, God's willing, we're going to arrive safely at our desired results. With the permission of the chief host, I would like to quickly recognize some of the chief executives that we have. Let me start from the ministry. I would like to recognize the Director General and Chief Executive Officer of the Nigerian Television Authority in the person of Malam Salihu Abdulhamid Dembos. We welcome you, DG. Thank you for coming. Also with us, we have the Director General and Chief Executive Officer of the National Orientation Agency in the person of Mr. Larry Isa Onilu. Thank you for coming. Also with us, very distinguished ladies and gentlemen, we have the Executive Secretary of the Nigerian Press Council, Mr. Dili Ezuga. Thank you for coming. Also with us today, very distinguished ladies and gentlemen, we have the Director General, Voice of Nigeria, Malam Jibrin Baba Indache. Thank you for coming. Also with us today, very distinguished ladies and gentlemen, we have the Director General, Advertising Registration Council of Nigeria, in the person of Dr. Olalekan Fadolapo. Thank you for coming. I want to believe from the Minister of Information. Okay, we have the representative of the DG National Broadcasting Commission, NBC, in the person of the Secretary to the Commission, Mrs. Franca Ayeton. Thank you for coming. I want to say that from Federal Ministry of Health and Social Welfare, we have with us the Director General, NAFDAC, Professor Moji Adeyeye. Thank you very much. Also with us, we have the DG Blood Service Commission, Professor Saleh Yoguda. Thank you very much. You're welcome. Also with us, very distinguished ladies and gentlemen, we have with us the General, National Institute for Cancer Research and Treatment, in the person of Professor Usman Malami Aliyu. Thank you so much for coming. We have with us the DG National Institute for Pharmaceutical Research and Development, NIPRD, Dr. Obi Adigwe. Thank you for coming. Thank you. We recognize all the directors from Federal Ministry of Health and Social Welfare and those from Federal Ministry of Information and National Orientation. Thank you all for coming. We welcome all the media aides from the presidency and from the two ministries. Thank you for coming. At this point, very distinguished ladies and gentlemen, before I now invite the chief host and the chief moderator of this event to give the opening remarks. But first, let me quickly give this information. I want to believe that after the presentation of the coordinating minister of Health and Social Welfare, we want to take some questions, maybe one or two questions from the gentlemen of the media. Please, let me quickly say this. When we get to that segment, we would like to request you to please, when you are recognized to speak, you tell us your name, the media organization you are representing. And please, restrict your questions to the issues to be addressed by the minister in his presentation. And let us be decent enough in the use of language. We will really appreciate that, please. I want to thank you for your readiness to cooperate with us. Having said this, very distinguished ladies and gentlemen, I want to respectfully invite the Honorable Minister of Information and National Orientation to please give the opening remarks. Honorable Minister, sir.
Thank you, and good morning, my colleagues, gentlemen of the press. I want to welcome you once again to this edition of the Ministerial Press Briefing organized by the Federal Ministry of Information and National Orientation. You recall that on the 14th of February, the ministry initiated this Ministerial Press Briefing. Now the idea is to have ministers and chief executives of parastatals of various ministries to come and speak to you, gentlemen of the press, who will now in turn inform Nigerians about the activities of government. The whole idea is to bridge the gap between the public and the government so that people will get to know what government is doing, government programs and policies at all time. This, of course, is in line with the commitment of President Bola Ahmed Tinubu to always ensure that Nigerians are kept abreast of happenings in government. In any case, this government is for Nigerians, and therefore Nigerians deserve to know. You also see that, distinguished gentlemen of the press, that is also an opportunity for you most of the time when you keep chasing some of these ministers and heads of parastatals to get them to talk to you about policies of government. The ministry also feels that this is a good opportunity for these ministers to come under this platform so that you get to know what they do, and then you also have opportunity to ask them questions. Like I said, today is the third in the series, and we have the distinguished honor of the presence of Professor Mohammed Ali Pate. He is actually the Honorable Minister of Health and Coordinating Minister of Health actually and Social Welfare. He is not new to you. All of you know him. Today he's going to talk to you about the activities of the ministry, and he also has directors and heads of parastatals under his ministry for you to also ask questions if you do know. Now, just as a way of reminder, I want you to know that or let me seize the opportunity to tell you that Nigeria is actually beginning to reap some of the benefits of the reform agenda of Mr. President. The National Bureau of Statistics only recently revealed that we have recorded a 2.54% growth. This is as against, 3.46% growth as against the 2.4 recorded in the third quarter of 2023. So you can see that there is a significant shift gradually from what is obtainable, in the first few months or before the administration came into being and what is happening now. The idea is that we will keep informing you what is happening, and then you get to know some of the shifts that are happening for you to have an informed decision about what you think government has achieved. We are also happy to report that there is, according to the MBS again, there is a capital importation that has risen to about 66% in this quarter, as against about 50% that has happened in the last quarter, before, well, even before the withdrawal of the petroleum subsidy. There is also this information that Nigerian Stock Exchange All-Share Index crossed the 100,000 mark. This is the highest ever, mainly due to the pragmatic reforms that the president has initiated. It's also heartwarming to know that our oil production has actually risen. The domestic oil production has risen from 1.22 million barrels a day in the second quarter of 2023 to about 1.55 million barrels per day in the fourth quarter of 2023. And we also know that our domestic refining capacity, according to the MBS, has also risen by about 8%. This is also heartwarming. Now, all this information is important that you put it out there so that Nigerians begin to see the kind of progress that is being achieved, before the withdrawal of the petroleum subsidy and what is also happening now. You recall that the president only a few days ago has also given a directive that the design of the social security unemployment program be made so that the teeming youth population can now be gainfully employed. He has given that directive, and he has also given the directive that the consumer credit scheme that was hitherto not in existence be also be brought to bear. All these are aimed at reducing some of the hardship that Nigerians are facing. You recall that only 2 days ago also, Mr. President has given a directive that the suspended National Social Investment Program that is giving 25,000 for 3 months to the poorest of the households has now resumed. Recall that sometime in January, the president suspended that program, and an interministerial panel was set up to review that process with a view to enhancing its efficiency and ensuring that those who will benefit from that scheme actually get that benefit. It was suspended for 6 weeks. 2 days ago, the interministerial panel submitted its report under the leadership of the coordinating Minister of the Economy and Minister of Finance, submitted that interim report to the Federal Executive Council and to Mr. President. Mr. President, therefore, gave a directive that it should resume immediately. All this is to ensure that the hardship being encountered by Nigerians is actually reduced to the barest minimum. We also know that in the last 2 days, the so-called Orosanye report, that is the report that was actually done in 2012 during the regime of President Goodluck Ebele Jonathan, to review the entire civil service and the public sector agencies, are now reviewed. It has been gathering dust, but now federal government has invited that this be reviewed, and after that review, it has now been put out, and the government and the Federal Executive Council has approved its implementation in total. Now, of course, there are some aspects of that report that are still being reviewed, but those that concern the scrapping, merger, subsuming of some of these agencies have already been undertaken. We gave a press conference 2 days ago for you to know. Some of those agencies that are affected are already been put out there for you to all know. Now, the whole idea is that government wants to reduce cost, also improve efficiency in service delivery. Now, this does not necessarily mean that government is out to retrench or to throw people out of the labor market. That is not the original intention. The intention is that efficiency has to be brought in, because some of these parastatals are actually having some overlaps in the way they do their operations. So all these things are, we feel that we should all remind you about some of these things so that you see what government is doing to ensure that Nigerians get the benefit of the democracy. We also, today, like I said, are going to have the coordinating minister for health and social welfare, Professor Ali Pate. The focus is going to be on health. The next time we come again, we intend to have other ministries to talk to you on certain key sectors of government. So I want to, at this juncture, invite Professor Ali Pate to talk to you, and then after which he will have about 20-25 minutes to talk to you, after which you will now have the floor to ask a few questions. But I want to advise that please, in the interest of transparency, accountability, and honesty, keep your questions to the issues at hand so that we don't cast the net so wide and lose the focus of this sectoral press briefing. Once again, I want to thank you for coming, and I do hope that we're going to have a very fruitful deliberation. Thank you very much. Professor Ali Pachina.
Thank you, Honorable Minister of Information and National Orientation, for inviting us. And thank you, members of the press, for showing up in large numbers for us to address you in terms of the work of the Ministry of Health and Social Welfare. I'm speaking to you on behalf of my entire team, the Honorable Minister of State, who is not here but attending to other things, the Permanent Secretary, the Directors of the Ministry, as well as the Director Generals of all our parastatals who are here, because they are here all in full force. And as we go to answering your questions later, if there are difficult questions, you know who to ask, because they are all here. You all are aware that His Excellency President Bola Ahmed Tinubu, as part of his Renewed Hope agenda, put health and the well-being of Nigerians at the center of that agenda of his administration. And when we came into office, after listening to Nigerians through a People's Voices survey, consulting various stakeholders, together with the officials of the ministry, articulated a blueprint. Our goal is to save lives, prevent, reduce physical and financial pain, produce health, and to do so for all Nigerians, so that we don't leave Nigerians behind in this aspiration to have good health and well-being. We articulated a 4-point agenda and 3 cross-cutting pillars. So the report that I will share with you is what has transpired since then in very tangible terms, and we can discuss them. On the first pillar of governance, to improve the governance of the health sector consistent with the National Health Act, we operationalize the national health system with the federal government and states signing a compact in December for the first time that governs the interrelationships between federal government and states to improve the health and well-being of Nigerians, along with the external development partners who are contributing, complementing what government is doing, but aligning with the priorities of government. And in that meeting in December, you all were witnesses when they announced $3 billion complementary to the federal government's effort for the next 3 years to be spent in improving the health outcomes of Nigerians, using primary health care as the basis for that. Of that announcement, we've already signed almost $1 billion in terms of grant, have approval for $200 million complementary grant, and the rest of the $3 billion is in line. We are proceeding with discussions to operationalize them in the context of the sector-wide approach to improve primary health care using BHCPF as a vehicle, and I will touch on it later again. We try to improve the positioning of the regulatory bodies in health. NAFDAC, to strengthen it from maturity level 3 to begin to move towards maturity level 4, so that we make safety of drugs, food that is mandated on us by law to be executed appropriately by NAFDAC, as well as other regulatory bodies, whether it's the Pharmaceutical Council or Medical and Dental Council of Nigeria or the Blood Service Commission, to ensure that the governance function, the stewardship role that we have, is executed as much as we can, and then to do so while responding to the needs of our citizens. So through consultation with civil society organizations, we had several fora with civil society to engage, in addition to the survey, the People's Voices survey, that asked Nigerians what is their need and how do we respond better. That citizens orientation, you'll agree with me, is one of the key pillars that the President has directed us to do, to respond to what Nigerians are actually yearning for, and we intend to continue in that direction. Now, the second pillar on improving population health outcomes, we're laser focused to improve the primary healthcare system with the interventions, preventive and curative interventions that will improve health outcomes, as well as our hospitals. We're expanding the primary healthcare centers that are benefiting from the Basic Healthcare Provision Fund from 8,000 that existed until now, some of which are not entirely fully functional, to make them functional and expand them to 17,000 by the end of 2027. And the primary healthcare centers, with the support of the federal government, complemented by the states, are delivering antenatal care, skilled birth attendance, immunization. And you will all recall, last fall we had an outbreak of diphtheria in Nigeria. It was in 14 states. By August, September, it had been going on for 9 months. Now, the diphtheria outbreak has receded. What have we done? We immunized 5 million children with the pentavalent vaccine as part of the diphtheria response, and 10 million children between the age of 5 and 10 with TD vaccines. So 15 million doses of vaccines. And that has curtailed the diphtheria outbreak, not as much as it was in August and September. In October, we launched the first phase of the HPV vaccination in 15 states. In the 15 states where this vaccine was launched to prevent cervical cancer, at least 4.95 million eligible children were immunized. That's 80%. That is an impressive performance by Nigeria for the first phase states. The second phase states will start their vaccination in May this year, and preparation is already underway, learning lessons from what had transpired in the first phase. And with regards to the Basic Healthcare Provision Fund, we've strengthened the fiduciary system so that the resources that will channel to the primary healthcare centers will indeed reach the primary healthcare centers and serve Nigerians. And we've had discussions with the Governors Forum, with the National Economic Council, and with the President's direction. We are tightening up the fiduciary system so that when we disburse 50 billion by the end of this first quarter of 2024, to the primary healthcare centers through the MPHCDA gateway or the NHIA gateway, the resources will indeed reach Nigerians and will be subject to social accountability measures so that we see the impact of those resources that are coming from the federal government's portion of the federation account. That's the 1% CRF. In addition, over the last several months, 2,497 doctors, nurses, and midwives have been recruited in our primary healthcare centers to fill gaps and to help in delivering services. And hundreds of thousands of Nigerians have been enrolled in the health insurance program through the National Health Insurance Scheme and the Vulnerable Groups Fund. We increased the quota for the schools of training of nurses and midwives. We doubled it. And we're working towards increasing that for other health cadres as well, so that we can increase the production of health workforce that we need. We know that in many parts of our country we're struggling with that. In addition, we spent time to build an approach to invest and renew the health infrastructure in our hospitals. Recently, as you are aware, the President approved, in fact, the infrastructural upgrades and equipping of 6 cancer centers in the 6 geopolitical zones, in collaboration with the NSIA. That is in the 2024 appropriation of the federal government. In addition, there are 8 diagnostic centers and 2 oncology centers that the groundbreaking ceremony will be conducted very soon as part of the renewal of the health infrastructure in federal tertiary hospitals. And if you look at the 2024 budget, basically it's towards physical upgrades, equipment upgrade, training of the health workforce. And then repositioning of the NHIA from the point of view of the financial protection to ensure that the mandatory health insurance scheme takes off. This has been going on for more than 40 years. Nigeria has not made enough progress, but with the new leadership in the National Health Insurance Authority, we are very confident that that progress will come. On the third pillar of agenda to unlock the healthcare value chain, there are several work streams under that agenda. To improve the environment for manufacturing of diagnostics, pharmaceuticals, biologicals, devices, health services, health technology. And we've made impressive progress in that direction because we have at least 3 entities that are coming in to Nigeria. A Brazilian company committed and has approved $240 million investment in the generic pharmaceutical industry. And we have diagnostic companies that are coming to establish manufacturing plants. We already have one that is established in Lagos, which we launched in December. And in addition, our local manufacturers, local pharmaceutical manufacturers, we engaged with them in Lagos, we engaged with them in Kano, and as we speak, the President had directed the Attorney General of the Federation to develop an executive order on the policy measures to reduce the barriers for them to manufacture, to protect the industry that we have, while reducing also the cost of pharmaceutical, which is biting alongside the cost of many other commodities and inflation that we are facing as a country. All these efforts are long overdue. If we had unlocked the value chain of Nigeria's health sector 10 years ago, for instance, these issues would probably have been mitigated. So we're playing catch up as a country, but this administration is very committed to engaging on those issues frontally. Most recently, we signed a $1 billion MOU with the Afrexim Bank to help unlock the healthcare value chain. That was last week. And essentially, it's not money to the government. It's money to be available for investors and participants in the healthcare value chain so that we can manufacture, produce materials here that will be useful, that will be effective, but also retain the economic value and create jobs for Nigerians. So health is not only a consumption sector, but it can also be a productive sector. And I think that direction, consistent with the President's direction and his agenda, I think will be unfolding very soon with this mobilization that we have. The fourth pillar of our agenda is on health security. That is an important element that all of us, regardless of which leaning you have in this country, health affects you. We saw that with COVID. We saw that with Ebola. If there's one thing that should reunify us, consistent with the President's direction, I think is around health and health security. Because there is link between health security and economic security and national security. And in the last few months, you've seen us try to reposition the Centers for Disease Control to be able to preempt, prepare, and be ready to respond to outbreaks. We adopted a One Health approach because it's multi-sectoral. So with collaboration between Ministry of Health and Social Welfare, anchored by the NCDC, we brought in Ministry of Agriculture, Ministry of Environment, Ministry of Water, Resources, to work together using the One Health Steering Committee platform to think of spillover events, because there are many diseases that jump from animal arena to human arena. Most recently is the issue of folks eating fruit bats in one of our states, where the bats had some antibodies that showed they were exposed to some infectious agents. So preventing that, we had a joint risk assessment and tried to mitigate that. And in addition to that, there are outbreaks that we're dealing with every day. It's not only Nigeria. Every month, tens of outbreaks are reported all over Africa. But in Nigeria, we're tightening our approach so that we are sensing early, have good surveillance systems, and be able to respond. For instance, Lassa fever. Lassa fever is a perennial virus that affects many Nigerians. It's been going on for 40 years. Lassa is a town in northeastern Nigeria, after which the virus itself was named. It's very prevalent all across West Africa. Every year it happens. Two things. This year there are at least 2,400 folks who have been infected. And so recently you had some cases from Kaduna and a few other states, almost 24 states. This is a virus that is transmitted because rats live close to human habitations, contaminate foods, and lead to this viral hemorrhagic disease that has high case fatality. In anticipation of this year's Lassa outbreak, in October, November, we pre-positioned resources at the NCDC. Pre-positioned materials, PPE, personal protective equipment. We also pre-positioned ribavirin, the antiviral drug, and the testing for that, so that we're able to respond quickly. But there's a wider issue of awareness which you, the members of media, will need to inform Nigerians to keep food away from rats that are encroaching in human habitation. While we on the health side are taking measures to ensure that we are appropriately responding. In addition, in November, we launched a task force to start working towards a Lassa fever vaccine development in Nigeria, chaired by the NCDC, the NAFDAC DG, our development partners, to start conducting studies to understand the epidemiology of Lassa fever, because we know there are candidate vaccines, so that when the vaccines are developed, they are manufactured in Nigeria, that they are safe and effective, and they're deployed in Nigeria. That task force is doing its work currently, so that in the future, when we have vaccines, people can take the vaccines against Lassa fever, that we don't have to lose people every year, lose health workers, unfortunately, from this virus. Meningitis. Many years ago, we used to have tens of thousands of meningitis every season because we're in the meningitis belt of West Africa. But because of the intense efforts to vaccinate, much of those outbreaks have now become history. This year there are reported outbreaks, but we are able to, with our partners, sense where those outbreaks and mobilize. And in fact, before we came here today, we are trying to mobilize vaccines for the meningitis that came out in Yobe State, for instance, where to mitigate it so that it doesn't spill over. Because in health, in other sectors, when there is success, it's in things that have happened. But in health, our success is in things that have happened, but also a lot of our success in things that have not happened, in badness that does not happen. So when we prevent meningitis, and you have 100 cases, well, it's sad, it's tragic. But without the interventions that we are making, it could have been thousands. When you see Lassa, 2,400, it's unfortunate. And we'll respond to that, and we're responding to that. But without those interventions, it could have been much more in numbers. So you have to also factor that in the assessing what the ministry has been doing. And I believe that the issue of health security is so vital, and that we needed to work with our colleagues and the states. And at the National Council on Health in November, we did pass a resolution encouraging all state governments to also set up their public health emergency operation centers so that we coordinate better. When there are crises, we get the data, we know where it is, and we mobilize the resources. I will end by mentioning the cross-cutting pillars of our effort on data and digital transformation. And very soon, we'll launch a team that will be conducting an intense effort, and we have it in our 2024 budget, to begin to use digital technology to leapfrog in our health sector. That will be a collaborative effort by different parts of government, including the Ministry of Digital Economy, and my colleague, the Honorable Minister of State for Health, will be leading that effort. We had also, as I earlier mentioned, the sector-wide approach, the compact that we had developed, is to defragment the sector. Until this administration, the sector was hyper-fragmented. Everybody was doing what they really wanted to do, including some of our development partners. But thankfully, over the last several months, we have had really good alignment. Our partners are saying, what is government's priority, and how do we support that? And how do we work with the state governments and to achieve results? And we'll be reporting on those results on a regular basis, in addition to the statutory requirement of the state of health, which is provided for by the National Health Act of 2014, but had never been done. But this administration is working towards doing that. The National Consultative Forum on Health and Human Capital is also provided for by law. That has not happened. So we are organizing to have a consultative forum of all our traditional leaders, religious leaders from all parts of the country to engage them on these reforms that we are making. Now, I do also want to mention for NHIA, the National Health Insurance Authority, because it's not just about insurance. We all insure our houses, our vehicles, and all of that. Health insurance is so vital because it is something about financial protection. The cost of ill health can tip populations to poverty. There are many Nigerians who are suffering from the catastrophic expenditures because of ill health. So expanding health insurance is a key priority of this administration. And we're repositioning the NHIA. And while doing that, they've been focusing on increasing the enrollment numbers. And I believe in the last several months, more than 750,000 Nigerians have been enrolled. These are new enrollees. As part of the reforms that we're pursuing, you cannot insure people that you don't know. So identifying them and ensuring that, in fact, we count them properly while we're expanding the public revenue to provide the protection, because you cannot insure someone in abstraction. Somebody has to pay for it. And federal government is putting its resources, and we are encouraging states also to pay the premiums for their own formal sector employees, and then other innovative financing arrangements so that we pool and provide cover for the poorest Nigerians, so that those who are traveling abroad, for instance, for medical care, at least we should also think of those who don't have the resources to travel abroad, because the inequality in distribution of health outcomes in Nigeria is very stark. While we're expanding the infrastructure in health, we hope people will not travel abroad, and that some of the $2 billion that we spend in medical tourism abroad will be returned at home. But at the same time, we have to ensure that the poor Nigerians as well have some protections so that they get the basic care as well as hospital care when they are needed. And we're mobilizing in that direction. I think, Honorable Minister, I will stop here. And members of the press, you can now ask your questions. As I mentioned, my colleagues are here. So I will take the easy questions, and the most difficult ones I'll ask my colleagues to answer. Thank you very much. Yeah.
Thank you very much, Honorable Minister. Like we said, this is going to be a question and answer session. But I just want to make a small amendment about the talk I made on the Orosanye report. I wanted to say it is also called the Orosanye report, not so-called. It is also called the Orosanye report, just for you to note and amend in your submission. And at the end of it all, the speech or the presentation of the Honorable Minister, he has made it, and then it will be distributed for ease of reference for you. It's also important for you to know that my remarks are also being produced here, and it's going to be circulated for ease of reference. Thank you. You may now continue.
Thank you very much, Honorable Minister. I listened to the coordinating minister towards the tail end. He said, we are repositioning. And when you reposition, it's for good service delivery. Information, they say, is power. Correct information brings clear thinking. And clear thinking helps people to make sound judgment. I want to thank you so much for that wonderful presentation. Thank you so much. While the presentation was going on, let me say that the Director General of Federal Radio Corporation of Nigeria, Dr. Mohammed Bulama, just walked in. You're welcome, sir. Thank you for coming. Also with us, we have the Managing Director, News Agency of Nigeria, Mr. Ali Mohammed Ali. Thank you for coming. Thank you so much. We welcome the presence of the Director General, NCDC. Please, wherever you are seated, you may please rise for recognition. Please, thank you so much for coming. At this point, we are moving into a very important segment of this press briefing, which of course is the question and answer section. For those of us who believe in developmental media practice, at this critical time, the media is expected to play a supportive role in the implementation of policies of government. I want to say at this point that we agree that the media sets agenda on matters of public interest. The health sector is a critical sector in Nigeria. At this point, very distinguished ladies and gentlemen, like I laid from the beginning, we are moving into the question and answer segment. Please, if you are recognized to speak, you tell us your name, the media organization you are representing. And please, restrict your questions or your comments to the issues addressed by the Coordinating Minister of Health and Social Welfare in his presentation. Let us be decent in the use of language. Please, I want to plead with those of us at the back, let us maintain a very good silence to enable us have a robust interaction in the course of this segment. At this point, very distinguished ladies and gentlemen, I want to declare the floor open for your questions, please. One.
Good afternoon, ministers. My name is Malakai Uzendo. I'm the editor of Authority Newspapers. In your presentation, sir, you spoke about training, increasing the number of medical schools and medical students and so on and so forth. But it does appear that there is a lot of mischief in that direction. When I mean mischief, it is something that I'm experiencing as a father. That you have a child who is in the medical college. A 5-year program will take that student 8 years. Or a 6-year program, 9 years or 10 years. Across the country. But what is most distressing is the issue of internship, whereby a student would have been inducted in the various disciplines. And then the student is left floating after the internship before you talk about national youth service. So you discover that a student in the medical college, for instance, spends additional 5 to 6 years outside of what the curriculum prescribes, and which is very, very frustrating, both to the students and to the parents. Please, sir, is it not possible that from the Federal Ministry of Health, you can instruct the various councils, medical and dental council, nursing council, pharmaceutical councils, to simulate the internship such that after induction, just like they do in NYSC, the students don't need to begin to struggle, or the parents bribing one institution or the other to get their children to have this internship. That is the area that I'm interested in. I have had all that so that others can make their contributions. Thank you.
The next question, please. The man of suit.
Good morning, Honorable Ministers, and thank you specifically, Honorable Minister of Health. My name is Somna Sambo, Director of News, Arise News. Honorable Minister, I want you to explain better your focus on medical industrialization in Nigeria, being one of the key reform policies that you're looking at. What exactly are the benefits that the nation will be getting from this, and how you're partnering with the private sector to get investments into revamping manufacturing and boosting medical industrialization in Nigeria? And of course, I'm also interested in how Nigeria can further strengthen disease control in hard-to-reach areas. In those years when we were growing up, we could see teams of vehicles going into hard-to-reach communities and all of that, and there was disease surveillance. But nowadays, I don't know, maybe it's because of the economic factors that are also affecting the health sector budget. It's been pretty difficult, and some communities look like they've been left to their fate when they are thousands of kilometers away from the state capitals or the city centers. And lastly, I also want you to strengthen the health system reforms that you've said that you're going to do. A lot of people are really counting on you because you're a visionary leader, and we help to strengthen the capacity of our hospitals. Some of them, once you go out of the federal tertiary institutions or medical facilities, our states are really not having it very well. The investments in the health sector is very poor by the states. So what are the subnationals doing to strengthen health investment and health system reforms? Thank you, sir.
Okay, the man there, yeah. No, please. The man at the back with cap, please.
Good afternoon, sirs. Daily Anof is my name, and with the Nation newspapers. Sir, there's so much movement in the health sector with all the reforms and programs going on, but then the social welfare part of your ministry, there seems to be almost nothing happening. What could be the challenge, sir?
Honorable Minister, maybe we'll just take the first 3 questions, maybe you may, so that we don't lose focus, please. No, you have a microphone there.
Very good. Well, thank you. I think all these questions, I would say, are excellent questions. And let me try to respond to them one by one. On the human resources and the training of health workforce, that's a major agenda for this administration. And in fact, some of what we had started doing was noticed by the Bureau of Heads of States of the African Union. And as you recall, 2 weeks ago at the African Union, they appointed His Excellency President Bola Ahmed Tinubu as the African Union champion on human resources for health and community health delivery, because it stands out what his administration is doing across sectors, but with a focus on the human resources. In addition to expansion of training, but also try to streamline the processes for retaining those who have been trained. You also recall his decision whereby we streamline and be more efficient in terms of the waivers for recruitment of health workers in particular. That is an exception. In addition to ensuring the health regulatory bodies, the professional regulatory bodies are funded as well, which is an exception. particularly on the internships, which is within our remit. With the MDCN, we're working to operationalize an electronic matching system. Let me explain to you what it is. So take a large country like the United States, which is several folds, has more physicians, more population, but they do matching of their interns and residents electronically on a single day. Residents that are graduating get matched. You don't have to lobby anyone so long as you are qualified. So we're working with the MDCN to ensure that we streamline the way of matching so that an intern doesn't have to lobby anyone or to bribe anyone or to beg anyone. Intern is a trainee still before they get to new service. But this has not been done for a long time, and this administration is trying to move the needle so that we make it easier for our young ones. We met with many professionals who were trained outside this country, who had to be vetted, because health sector is one sector where you don't want a poorly trained provider or somebody who doesn't meet up the standard. I'm sure in this room, nobody will want to be treated by a doctor who doesn't really know his left from his right. I'm not saying that this is the majority, but you never know. And the role of the Medical and Dental Council is to vet, to ensure that those who are licensed, even provisionally, are competent enough to provide safe and effective service to Nigerians. I think, so I will say that we're working on that, and you should see steady progress, especially with the new leadership of the Medical and Dental Council of Nigeria. The question of medical industrialization, if I can just explain, there's a value chain in health. We have not tapped it. Health as a part of our GDP accounts for less than 4%, which is half of what it should be. In many countries, it's much larger. And it's been ad hoc. We've allowed ourselves to just import things, pharmaceuticals, 100% of our devices, and many thare So what are we doing? There are aspects that have to do with policy. The fact that we are prioritizing local manufacturing and looking at fiscal policy measures. So reducing barriers for importing raw materials or equipment so that those who are manufacturing here can be able to, can be able to manufacture, streamlining the regulations, and NAFDAC is here so that we simplify the processes that manufacturers will need to follow to get to manufacture locally. And then enforcing the 5+5 and reviewing it, in fact, so that if you import, after a while, you lose the opportunity to import. You have to manufacture so that we are not perpetually dependent on imports from outside. And then pooling of what government will buy to prioritize domestic manufacturers. There's an executive order already that allows for a premium for locally manufactured products so that we patronize what is produced in Nigeria. At the end of the day, some of the products that are being imported, believe you me, we are just paying large amounts of money for the brands because we, as Nigerians, had made a choice. We don't like what is ours. We like what is imported or produced elsewhere. That mindset shift has to occur. And the regulatory bodies, we've been really working hard with NAFDAC and PCN and others to ensure that once we approve that things that are produced here are safe and effective for use, Nigerians can patronize them. That is how we can revive the industry. Thirdly, on financing, it's not public sector finance to private sector, but mobilizing the private sector resources so that financially viable, market-tested investments can be supported. And the Afrexim Bank MOU, and there are others. I mentioned the $240 million investment approved by a company from Brazil to manufacture locally. But there are also local manufacturers that are working towards expanding their pipelines to produce certain lines of antibiotics in Nigeria. And then the supply chain itself to be defragmented. Over the last weekend, I was in Kano. I saw the coordinated warehouse complex that was built in Kano State. Because if you don't have a control of your warehouse, of your supply chain, all kinds of counterfeits can get into the market and they will undercut the local manufacturers. And we have many of those because until now, the supply chain for medical commodities, anybody can buy stuff, import them, and sell it to people. So those are the measures that government is doing. But there are things that the private sector itself will have to do, which is organizing itself better, being strategic in terms of the niche they want to play, and to compete with the support that government will be providing them to compete favorably in the market without creating unnecessary distortions. And we see the private sector as very, very important partner. I think the president has said it repeatedly that Nigeria is open for business, but we say in the health sector that the health sector is also open for business, but also laser focused to ensure that the public mission is not undermined, that the private sector participates, but that the public mission, that we don't leave some Nigerians behind, that we provide what is necessary to protect the health of everyone, even as the private sector invests and contributes in a complementary manner to what the federal government is doing. The disease control question on surveillance you had to reach. We have one of the best surveillance systems, for instance, for polio eradication. And we're deploying that for many other diseases. And you hear the outbreaks of this or that, because there's a very good network of surveillance in this country. Any child that has flaccid paralysis that is acute will have stool tested, and within certain hours will have to get to a lab, and that will be tested. And the viruses identified are fingerprinted. These are behind the scenes. These are the measures that we have put in place to know that when there's an outbreak in Nigeria, that we get to know it quickly and it gets reported, whether it's measles, whether it's the cases in Kaduna, whether, like I told you earlier, meningitis, or whether it's AFP for whatever reason for the mutant polio viruses. We've trained epidemiologists through a program hosted at the NCDC. There have been thousands of Nigerian epidemiologists. They're among the best in Africa. In fact, the Africa Center for Disease Control is complementing Nigeria, because when there are crises, other countries, either in the sub-region or in Africa, Nigerian epidemiologists get called to actually go and respond, because we have had a very vibrant training for those epidemiologists. I mentioned that in November we approved a resolution at Council on Health to have state public health emergency operation centers. At the federal government, we have those emergency operation centers, MPHCD as well as NCDC, and in some states. But we're asking state governments to establish their own public health emergency operation centers. And where there are gaps, federal government is willing to step in so that outbreaks can be stopped before they spread to other states, before we get a pandemic. Because a pandemic or epidemic starts from an outbreak. Our idea is to prevent these diseases before they spread. So it's still very much work in progress, but we're focused on it as part of the health security pillar of this administration. The hospital situation, I have to say, in the last few months that we've been in office, both my colleague, the Minister of State, and myself, we've visited many hospitals. And we're very impressed with what the federal teaching hospitals, the tertiary hospitals are doing. Many of them, in fact, this is some of the, let's say, the perception gap. People travel abroad, but there are some of our hospitals doing amazing things. Teaching hospital in Zaria yesterday did a very complicated urological surgery, transplants, many other interventions that are happening. But the state governments, I think, have, in a way, not invested as much in the secondary facilities. But as part of the compact that we signed in December, witnessed by the president, we asked them to invest more in their health infrastructure as well, to complement what the federal government is doing. On the social welfare question, the gentleman asked the social welfare part of the ministry. Well, as you know, it's constitutional. Government, social welfare is one of the key expectations on government, and this administration put it front and center. but it's a cross-sectoral, whole-of-government effort. We take the approach that welfare of Nigerians, there are several intersections to the welfare of Nigerians, whether from the adolescent girl and the young woman, and the work of the Ministry of Women's Affairs is very important in that social welfare agenda. The work of health in basic maternal, newborn, and child health is really touching to the welfare of Nigerians. When I said hundreds of thousands of women access antenatal care, get skilled birth attendants, that is really to the welfare of Nigerians. Whether it's expanding the Vulnerable Groups Fund, that's financial protection for Nigerians. Whether it's the intersection with education, whether it's the intersection with some of the interventions on social investments, some of which the Honourable Minister has touched upon, and whether it's on aging and taking care of our aged population. Specifically in the Federal Ministry of Health and Social Welfare, we've developed the concept of a social action fund, and His Excellency Mr. President has approved it. It's in the corrigendum that we're expecting from the National Assembly. What is a social action fund? It's a way of supporting communities to address their needs, so that we are not determining from the federal government, from Abuja, what a community out there is prioritizing, but that they have transfers in collaboration with the states and local governments so that they can relieve those constraints, in a way trusting those community-based systems to function, to address the priorities of Nigerians. Because the convention is, it's always easier to spend on large items, big roads, big buildings, multi-billion-dollar projects, and yes, those are necessary for growth. But the problems in many of our communities are very small. Some communities need a protected well to have clean water. Some just need a roof over their primary health care center. And how do we get that? And those are not things that are, let's say, conventional, but this administration is developing this concept of social action funds to be able to address that, but to do that in partnership with the states, with also some of the development partners, so that we begin to also respond to the needs of Nigerians, to build the social capital that is inherent in our communities, so that people will feel the impact of the wider reforms. And the minister mentioned some of the economic growth that is being pursued, and we're seeing progress in that line. So thank you. I'll stop here.
Thank you very much, the Coordinating Minister for Health and Social Welfare. Okay, you are still raising your hands. Okay, beautiful. Before we take another round of questions, we should allow the Honorable Minister to take water, because they said water is life. Please. Thank you. So let's see your hands. 1, 2, 3, 4. We end it there. So please give the mic to my number one person in the front, please.
The Honorable Minister, some of your predecessors embarked on a very massive project, that's revitalization of over 1,000 basic health clinics nationwide. Can you give us a status update on these basic health clinics and what has become of the project? Thank you.
Honorable Minister, sir, my name is Yakin Akinwale. I'm the Deputy Editor at the Cable Online newspaper. Between 2016 and 2018, over 9,000 medical doctors were reported to have migrated abroad. And you said in your speech that in the last 6 months, the government recruited 2,497 health workers, including medical doctors. In the face of mass exodus of medical doctors, do you think Nigeria has enough medical doctors to take care of our health need? Thank you.
Honorable Minister, My name is Sonny Daniel. I work with Vanguard newspaper. I don't really, if you don't have an answer to give me, it does not matter. But take note of the few issues which are still struggling with health care delivery in Nigeria. You may wish to take a look and see what can be done, because when you left Gavi and came to Nigeria to work as the coordinating Minister for Health and Social Welfare, there is a very high expectation by Nigerians that certainly this type of a person will leave a mark. Number one, you may wish to take a tour privately. Don't make noise about it when you are going to hospitals. For instance, go to the national hospitals and see how they are treating Nigerians, and see for yourself, because if you make an announcement, everything will be all right by the time you visit. And you can also go to other tertiary institutions in Nigeria and see whether what you are expecting as a renowned health professional is what they are giving to Nigerians, given the facilities we have. Again, in this country, it is a taboo for doctors, nurses to attend to gunshot victims. It's still a taboo. Even though if you ask the IG, it will tell you he has given instruction. Can Nigeria not have a policy to treat gunshot victims, whether they are the assassins or victims? When they have recovered, they can be sent to court for trial, so that life are saved first. Again, where you came from, drugs are readily made available at affordable prices to the people. How are we suffering like this? The cost of drugs have reached the rooftop. And what can you do to bring down the cost? At the same time, Nigeria is a country where people can easily go and produce fake drugs and bring here and sell. How do we close the route so that what we see and buy is nothing but genuine drugs that can save life? And finally, so that I don't behave as if I'm dictating to you, when people are said to have cancer in Nigeria, everybody will begin to stigmatize and begin to sympathize. How do we make it possible that if somebody is diagnosed of cancer, there is a chance, there is hope that the person would recover? Thank you very much. You don't need to give me an answer, but think about them. Thank you.
Okay. That's the last one for the day, please.
My name is Tony Esmak. I work with independent newspapers. Honorable Minister, there have been reported cases of mental health challenges, especially among young children since after COVID. This has been on the rise. Anxiety disorder, moderate to severe cases of psychological issues among young children. I don't know whether you have this information from the various hospitals, and if you do, what is being done to address this aspect of the health of the nation? My colleague has taken the last question, which has to do with the skyrocketing cost of drugs and basic medicines. What is being done to address it now?
Please take the microphone to the first speaker. People said you did not introduce yourself, please.
Honorable Minister, I'm Yusuf Ali, Managing Editor and Other Operation for the Nation newspaper.
Honorable Minister, you may please wish to respond to all the questions. Thank you.
Yes, thank you. I managed to get some water, and I think my throat is a lot clearer now. So I think the first question on the basic healthcare revitalization. There are 3,600 or so primary healthcare centers that had been upgraded over the last several years. out of 8,800 that are receiving direct facility financing from BHCPF. We are going to make those outstanding ones functional and expand the facilities to 17,000, because we had to take a baseline of where we are, because the Basic Healthcare Provision Fund is meant to provide resources to make them functional to serve Nigerians. And we've said that repeatedly as part of the sector-wide approach and what we are doing with Basic Healthcare Provision Fund 2.0, the redesign that is underway. This week, all the 36 commissioners of health of the Federal Republic of Nigeria are here in Abuja, and when I leave you, I'm actually going to meet with them, because today, tomorrow, and Friday, they will be bringing the list of the new ones for the next phase. Because what we announced in December, it's something that we have planned for on a monthly basis, what we are going to be doing through MPHCDA. Signed a compact on December 12th. So we've drawn a line, what we saw, but we are building on the back of that so that Nigerians over the next 3 years will see more of their primary healthcare centers functional. But it requires the states who own those facilities to also work with us to ensure the resources that will channel to the states are used for the intended purposes. And I know that when we presented to the National Economic Council last week, all the governors agreed, and we got feedback that in fact they are very keen to work with us in that direction, consistent with what the President had laid out. On the migration of, do we have enough health workers? There's no country in the world today that has enough health workers for what it needs. That's why they are poaching from us. That's why the developed nations are recruiting our doctors, because we train our doctors, our nurses, our health workers so well. That's why they are being recruited. So what are we doing about it? We develop a managed migration policy whereby we acknowledge that some will leave, but let's train more. And the expansion of the training, and that requires collaboration with Ministry of Education, but also the states themselves to have training institutions, and our parents, our young ones, to really get into medical professions, study sciences. There are many folks looking for a job, but there are some jobs that if you are not trained for, you cannot get a job in a hospital if you did not train for it. So encouraging our youth to be involved, to study hard, and to have those slots, that the expansion that we've made, so that we can train more. And if some inevitably leave, at least more will stay and serve in this country. And there are many, many health workers who could have left, are actually serving in this country because they really want to contribute in Nigeria. I saw many of them, and we should also appreciate them. The issues raised by the Vanguard, the colleague from Vanguard, I think those are all pertinent issues, and I will not give you a long answer. I will say I have heard them, and I want to put all our federal tertiary hospitals on notice that the Minister of State and myself will make surreptitious visits to those facilities unannounced to see what they are, so they should be ready, that we will. And I know that we have the mandate of His Excellency the President. If any of our chief executive does not focus on the quality of care in their hospitals and we see lapses, we will take drastic action against them, because at the end of the day, these are public institutions and their focus is to provide services to Nigerians and to ensure that Nigerians are respected when they are given those services. There are many challenges that health workers are facing, which are not, let's say, new, but we acknowledge them and we're working very hard to see how we can remediate them. And even though they are facing difficulties and we appreciate them, we also have signaled that it's important that we pay attention to service delivery and the quality of service delivery. And we will be tracking that. And we have put our chief medical directors on notice on that. On gunshot, we have stated it. I had publicly stated it. And my colleague, the Minister of State, had stated it. We have written to IG. I know that it had been signaled. The issue is the non-public facilities, the private facilities. Some of the state facilities may not be paying enough attention. So I think if we accept as the norm and the press themselves amplify this message, that it's not acceptable to lose a life when one can actually save that life, it's not acceptable. I think we'll begin to see change, and we call on all health workers to prioritize saving lives. The issue of affordable drugs is one of those topical things. Even before you raised it, just on noticing the rising prices, we raised it ourselves. We brought the local manufacturers. We brought the pharmaceutical group of Manufacturers Association of Nigeria. We met with them 4 times. I was in Lagos. The president himself was very concerned about some of the industries that were closing, and he addressed it in council, and he asked the Attorney General to develop an executive order. You see, when you take some decisions like this that have to do with the overall market, there are many considerations. But I tell you that we're on the verge of making some of those decisions that will make it easier for our local manufacturers to thrive. But the backdrop is that we've been import dependent for finished pharmaceutical products for a very long time. To change it is what we are working hard on, because the raw materials, we have to import them still. The equipment, we have to import them. So how do we make that easier? And how does NAFDAC, and DG NAFDAC is here, we've met more than 8 times in the last few months. And if you look at the federal government's budget for 2024, we have provided for a pooled procurement of key pharmaceuticals so that we can subsidize. And we call on states to also mitigate some of that impact, and some of our philanthropists, so that we make it easier for Nigerians. Those who are poor, they should not die because they don't have medicines for their diabetes or for hypertension or some other things. But the more distressing part for me is the counterfeit issue. There's been steady progress in reduction of counterfeits and substandard medicines in Nigeria, and NAFDAC was acknowledged by WHO. It has not been eradicated yet, but compared to how it was in the past, there's been steady reduction to less than 15% in the Nigerian market. The issue is that there are Nigerians who are, I'll say, bad actors, very bad actors, who have folks that are complicit, who undermine the regulatory function of NAFDAC. And the distribution system is porous, and I was in Kano at the CWC warehouse, and I saw the effort to streamline that. But people were protesting. They want an open drug market so that you go and buy drugs that are not working out in the open market. That is killing people, and that is not acceptable. And government is trying to enforce it, but we need the collaboration of state governments also to ensure they don't tolerate those open drug markets, because they are also providing avenue for illicit substances, narcotics, to get into populations and undermine the health and well-being of our youth in particular, linked to the question of mental health. There are many youth of this country that are unfortunately falling into the trap of substance abuse because it has been easy. But I know that NAFDAC, the Pharmaceutical Council of Nigeria, and NDLE are working very hard, and some of our security agencies also collaborating behind the scenes to ensure that we stop that. So on cancer, I think it's a big issue. First of all, prevention. So like cervical cancer, there's a vaccine for it. Let's just get our children vaccinated. Cancer screening, so that people get detected early. Some of these cancers, colon cancer, cervical cancer, they take time to develop. If you are screened early, you can have remedies that will prevent and make it more likely that you can be treated, because some of these cancers are now imminently treatable. The infrastructural investments, I know we've announced it, that President directed that 6 major cancer center upgrades and infrastructure, so that we have linear accelerators, so that for those who are affected, they have the world-class equipment to treat their cancers. The Director General of the Cancer Research and Treatment Organization is also here. So we are tackling that head on. The deficit we have in the Nigeria's health system did not occur in the last 12 months. It occurred over several years. This government is committed to revamping the health infrastructure and putting this country's health system on a much better path. And that is very much in line with the President's agenda to restore the hope of Nigerians. And I believe that we will succeed together with all our colleagues in government, but with the state governments, with the civil society, with the private sector, and with you, the members of the media, to explain that it is all of us that will reposition Nigerian health sector, because we are all beneficiaries of it. If there is no good health system, all of us are vulnerable. So thank you very much, Honorable Minister.
Thank you, Honorable Minister. When the Honorable Minister was making his presentation, something occurred to me that beyond water, we probably need a first aid facility in this conference. So I will charge the Honorable Minister to help us a first aid facility in case of any emergency in this. But we don't hope for it, but I think it's good that we have it. We thank you very much for this very thought-provoking address this morning, and I also like the way you concluded by talking about the sense of patriotism that all of us need to rekindle. Now, this is what the National Orientation Agency under the Ministry of Information and National Orientation is always talking about. We need to reorient Nigerians about the need for them to be very patriotic, to think well, and to also be very upright in the way they do their things in this country. And the Honorable Minister touched on something that even when you say that there is brain drain, people are leaving this country, it is because we are training our children here very well. So we also need the second level. We train them and then we return them. We'll continue to do that, but it's not entirely very unhealthy when people leave. But it's good that we also find a way of retaining especially our medical personnel to remain in this country. Now, so many things are happening. You heard about what he said about the $3 billion complimentary, $3 billion complimentary funding that is already attracting, the work he has done in NAFDAC, the $240 million from the Brazilian investor in the health sector, and so many of these, the Lassa vaccine, that is already been developed, the mitigation in meningitis outbreak. These are all some of the things that the minister has been talking about. And like you said, success in the health sector is not just in the way you treat, but also how you have, prevented it. Because the prevention is the unseen part of the health achievements of any nation. We know that we're going to deepen that. And gentlemen of the press, let me close by saying that this country belongs to all of us. What we are doing today, as we always do, is to ensure that the media, Nigerians, those who are also at the position of leadership, are brought together for a conversation around how this country will develop. I think it is important that we need to emphasize the positives out of this country. I've learned so much from what has happened today, and I'm sure that my colleagues here have also taken copious notes about some of the achievements we are getting in this sector. We'll continue to do that, deepen this conversation across sectors so that Nigerians will be better informed. Hopefully, and I mean hopefully, my colleagues, let us report what is good happening in this country so that we de-emphasize the negative. Nigeria is a great country. We have so much to give. We have, of course, some challenges, but I think that it is something that we can all talk about instead of condemning our country and thinking that we can go elsewhere. We have no any other place to go. This is our country. We must remain here. We must all salvage it together. I thank you for this, and I assure you, gentlemen of the press, that we'll continue to have these ministerial press briefings. Occasionally we'll have others who are not just ministers, maybe heads of parastatals or agencies that we think they are critical for Nigerians to know what they are doing. We thank you, Honorable Minister, for coming, the Permanent Secretary, and all of you gentlemen of the media. Thank you very much for coming. I will allow the Master of Ceremony to end it. Thank you very much.
Thank you very much, Honorable Minister. When I checked the list of the team of the coordinating minister of health and social welfare, I saw professor, and doctor. I know that it takes a very successful personality to lead very successful people. Where you have 3 professors and 1 doctor in a team, definitely you should expect the results you are looking for. At this point, very distinguished ladies and gentlemen, I want to thank the gentlemen of the media for your time. We have come to the end of this press briefing. May we please rise as we take the national anthem, please. Thank you. The two ministers will now step down from the high table to exchange pleasantries with the gentlemen of the media. That's our protocol here, please.